First, let's take the number itself, the 2.3 million full-time equivalent jobs that the CBO said would be lost because of this health care subsidy. Eric, it's not because the demand for labor is gone. It's because the supply. People now have an alternative. Those people who are working because they need health care coverage no longer have to, and that is the result of having the subsidy. So it opens the choice set for households and individuals, and that is why the number is 2.3 million, not because employers are cutting jobs. That's a big distinction.
Okay, it's a question of incentives. People are no longer incentivized to work because they need health care coverage. They can get it from the government, especially if they're lower income and it's for free.
Well, it's not just about incentives, Eric. It's how the subsidy is structured. There's this huge drop-off at 250% of the poverty level. That's about $30,000 for individuals, about $60,000 for a family of four. At that point, the health care subsidy drops dramatically. People are much more on the hook for how much they have to pay in health care coverage. Because there is this discontinuity in the health care structure of the subsidy, that's why you see a bit of a perversion or distortion in the amount of labor supplied. This is true, Eric, of all subsidies that are structured this way, be it food stamps or Medicare. It's not unique to Obamacare.
All right, then should we not be surprised by this number? This was all part of the point, really.
It's not surprising. And actually, our healthcare analyst at BGov makes this important note that this was something that came out of the original legislation. The original legislation called for a much graduated subsidy decrease as income rises, but there was a Republican pushback that compelled the legislation to make the drop-off much more severe at the threshold. So in some ways, this is part of the Republican influence on Obamacare. But there is a second thing, Stephanie, that came out of the CBO report. The CBO said that there is no compelling evidence that there's been an increase in part-time jobs. Remember, this is part, again, of the Republican opposition to Obamacare, that companies would be incentivized to create more part-time jobs than full-time jobs. Right now, that does not look like it's happening.
Hang on one second. There's just one other thing that I'd really like to understand, Nela.
Sure.
The idea that the jobs are going to be quote-unquote lost. If certain people are no longer motivated to work in order to get health care coverage and they drop out of the labor force, are others not going to move in? There are a lot of unemployed people right now, in particular long-term unemployed people. Is there not an opportunity for those people to get some of those jobs, and to what degree is that factored into the CBO calculations?
And that's why there's a reason to be suspicious about these numbers, especially early on, especially because it's a projection, it's not a longitudinal study, and it also plays into this overall trend in the job market that as the population ages, workforce participation will necessarily decrease. A lot of these workers that could be targeted in the CBO projection may be people who would retire if it weren't for health care insurance. Now they can retire. So this is part of an overall trend. We can't totally direct that line, that diagonal, to Obamacare exclusively.
What's the impact on wages going to be?
Well, that's an interesting question that hasn't yet borne out. Look, we don't know. This is a very young program. There are a lot of open questions in terms of who's enrolling. Are there people who already had coverage? Is it low-income people who are looking for subsidies? Is it young people? Is it healthy people? Is it people with preconditions? We don't know. All we know right now is that we have this new program that gives people an alternative to work. Now, you may quibble with the incentive structure, but what you can't say is that it is a job killer, because right now CBO has shown no evidence that there is a reduction in companies actually trying to get people creating jobs.